know taking drugs like oxycodone can lead to addiction, right? Well, new research shows just how easy it is for prescribed patients to get hooked. We talked to the lead researcher from CU's Anschutz Medical Campus. How addicting are opioids really? They work well for treating pain, but
they also cause feelings of euphoria in some patients. And so probably when you get this medication, your pain is controlled, but some people feel better beyond pain control.
Dr. Susan Calcaterra studied patients prescribed opioids after a hospitalization. For 1 year, her team tracked how many times the patients requested refills.
We just said if you filled 10 opioid prescriptions in that year following your discharge, you were considered a chronic user.
And she found patients with these prescriptions were 5 times more likely to become chronic users when that year was up.
And there was another finding that stood out, a difference between surgical patients and medical patients with acute pain. Both had an increased risk of addiction, but the patients who didn't have surgery were more prone to chronic use.
Patients with acute pain often get better, and over time they don't need to continue those medications.
Hospital patients are rarely treated by their family doctors who know them better. For that reason, the Centers for Disease Control now telling clinicians to check patients for substance abuse and even mental health issues before prescribing the drugs. It's Dr. Calcaterra's new focus to prevent chronic use.
Whether or not it's the right thing to continue the opioid for chronic pain over time is a little more of a gray area.
And the CDC says drug overdose is the leading cause of injury death in the U.S. The number of overdose deaths has more than doubled in the last 15 years.